Now we will talk about some special points related with the pia matters and few important points related with the subarachnoid matter and dura matter. First of all, about the pia matter or pia matter. You already know about this pia matter. It is very delicate, it is highly vascular, it is closely covering all the surface of the central nervous system, right? Then there is another very interesting thing that when you look at the spinal cord, right, the pia matter around the spinal cord make a very special structure which is called denticulate ligaments. What are denticulate ligaments? Suppose this is pia matter. This is pia matter, not arachnoid. Here, pia matter make flattened projections outward, and these projections of pia matter, they are connecting the pia through the subarachnoid space and through the arachnoid to the dura matter. Right? These are the projections, right, from the pia matter laterally in the spinal cord, and they are anchoring the spinal cord. Let's suppose here it is spinal cord. So from the lateral side of the spinal cord, they anchor the spinal cord with the, what is this? Dura matter. Is that right? And of course, they have to pass through, what is this? Arachnoid matter, right? So we can say the special feature of pia matter is that pia matter has denticulate projections, right? Denticulate projection means teeth-like processes. On each side, there are 21 denticulate ligaments. We also call it denticulate ligaments. Right? So this was some speciality of pia matter. Then we come to the arachnoid matter, right? About the arachnoid matter, I told you already that this is not vascular. This is outside the pia matter, and there is a space between the pia and the arachnoid, and that space is full of CSF. Is that right? That is called subarachnoid space. And that space here extend downward. This lower end of the spinal cord, this is called conus medullaris. This lower end of the spinal cord is called conus medullaris. Pia is up to conus medullaris, but dura and subarachnoid matter, dura and arachnoid matter, they are going downward. This is dural sac, and this is arachnoid matter up to the end. But pia stop here, and only a small string of pia is going down from conus medullaris. This string of pia matter is called, just please, phylum terminal. Phylum terminalum or phylum terminal, right? So what is phylum terminal? This is the string of pia matter which extend from the tip of the conus medullaris up to the S2. S2 is the sacral vertebra 2, right? The point up to which dura matter is extending. And because this is the CSF, you know, CSF is filled between the pia and arachnoid. So CSF extend into this space, and this is called, this is subarachnoid space full of CSF, right? And spinal cord terminates at the level of, in adult person, spinal cord terminate at the level of, yeah, L2, and usually we take the sample of CSF through the lumbar puncture at L5, between the vertebra L4, L5 or L3, L4, preferably between L4, L5, number 4 and number 5. Is that right? Because when you push the needle up to this point, you can get CSF without risking the injury to the spinal cord. Is that right? Then we can talk about dura mater and its special foldings. Dura mater and its special foldings. Dura mater makes three very important folds. It makes many folds in the cranial cavity, but three folds are very important. I will explain them one by one. Number one is falx cerebri. Number two is tentorium. Yes, what is the name? Tentorium cerebelli. And third important is diaphragma sali. Diaphragma sali. I will explain one by one all of them, right? First of all, let's suppose this is the skull. Here is your beautiful. You understand? Clear? Here is the point, sella trashica, interior cranial fossa. Here is crista gali. And what is this? Cribriform plate, middle cranial fossas, foramen magnum. These landmarks are clear? Now, first I will put the tentorium cerebelli in picture. Tentorium cerebelli is a fold of dura mater, which basically is making a notch here, and it is extending, I will tell you exactly, interiorly this fold of dura mater is attached with the clinoid processes at this point. Then it is progressively attached on the petrous part of temporal bone on both sides, right? On the back it is attached with the parietal bone and occipital bone, right? Now what it is doing, all this green partition, it is dividing the cranial cavity into supratentorial area and infratentorial area. If we draw the skull diagram, anterior cranial fossa, I hope you understand that. It sounds familiar. Actually, dura mater from here, it moves like this, and this is the fold which is called, what is this fold called? Tentorium cerebelli, and it is having extension like this and extension like that, right? Interiorly. If I make it three-dimensional picture, then it will be more clear to you. Now this pocket is posterior cranial fossa, an infratentorial part of the cranial cavity, and all this is supratentorial part of the cranial cavity. Are you clear, Murtaza, or not clear? If you are not clear, tell me, I will draw a better diagram. You are really clear? You want better diagram? This is anterior cranial fossa in which the frontal lobes are sitting, right? Here the temporal lobes are sitting. Is that right? Now, what really happens, that dura mater make a hole first of all here. Is that right? And from here it bridges all the surface like this. Is it clear? And here is posterior cranial fossa. What is this? This is foramen magnum, and here it is clivus. Now what really happens, that here is spinal cord, you know it under this. Here is medulla, here is pons. Again, what is this structure? Medulla. What is this? Pons. And what is emerging from here? Midbrain. Is that right? Pons, medulla, midbrain. And what is on the back of it? Cerebellum. These are the structures which are present in infratentorial area, right below the tent, below the tentorium. Clear? Then when it goes up, what is there? Here is pituitary and here is hypothalamus. This is hypothalamus and what is it? Pituitary, anterior pituitary, posterior pituitary and pituitary stalk. Clear? Here it is which lobe? Frontal. What is here? Parietal. This is all frontal. Then here it is parietal. And what is on the back? Occipital. And what is here? Temporal. Is that right? Am I clear? Now, but due to this partition, cranial cavity is divided into supratentorial area and infratentorial area. Infratentorial is housing the cerebellum plus brainstem. Through this notch, tentorial notch, midbrain is connected upward with the cerebral hemisphere. Supratentorial area is housing the cerebral hemisphere, right and the left. Am I clear? No problem? Right. So this is one, you can say, fold. Other fold is that fold of dura mater start from crista galli. And this fold of dura mater moves like this. And it gets connected look, this is one hemisphere, this is other hemisphere. This fold starts in the front and passes through the fissure between the two hemispheres backward. And posteriorly it comes and attaches in the midline at the top of tentorium cerebri. This fold is called falx cerebri. What is this called? Falx cerebri. Is that right? So one fold is tentorium cerebri. We divide the cranial cavity in upper story and lower story. And other fold is running anteroposteriorly vertically, which is dividing the supratentorial cavity into right half and the left half. Is that right? Now what are the purposes of these folds? Actually these folds mainly prevent the excessive movement of the brain within the cranial cavity. For example, by tentorium cerebri, you have created supratentorial region and infratentorial region. And there are some structures housed in infratentorial area, other structure of the brain in supratentorial area. Then falx cerebri, this is present between the interhemispheric fissure. There is right hemisphere and there is left cerebral hemisphere, and they have a fissure. Through fissure, falx cerebri is there, so that it stabilizes the supratentorial brain substance appropriately in the right and the left chambers. Am I clear? There is no problem with this. Third, one more fold is at this point. And this is a fold of dura mater which is present at above the sella trachea. Now what is sella trachea? Again, let me make another diagram. Now listen carefully. Now you have to tell me the name of the fold. If dura mater comes like this and moves forward, what is this? Yes? Tentorium cerebelli. Tentorium cerebelli. And you already know the structure. What was passing through it? Midbrain. Pons, medulla. And what was this? Cerebellum. Then there was a structure. It started from here. And what is it called? Falx. Yes, falx cerebelli. Another structure which was present over there is, now what is this? This is the point where what thing is sitting here? This is hypothalamus, right? And here is pituitary gland, this is pituitary stalk. Is that right? There is another very special fold here. And through this, the hole in the fold allows the connection between the hypothalamus and the pituitary. Pituitary is below this fold. Fold is called diaphragma sali. Pituitary is below that and hypothalamus is above that. And pituitary stalk is passing through this hole, right? If I make it, it will become like this. This is the fold of the dura mater. And now you must be knowing what is passing through this? Pituitary stalk. And what is under it? Pituitary gland. And what should be above it? Hypothalamus. Am I clear? Right? Another thing. Dura mater is sensitive to the pain. Dura mater is very, very sensitive to the pain. And we must know the nerve supply of dura mater. Brain substance itself is not pain sensitive. Brain does not have pain receptors. But dura mater is pain sensitive, right? And if dura mater is unduly stretched or hammered, it produces severe pain. Is that right? And we must know that which part of the dura mater is supplied by which nerves. Primarily when we talk about the innervation of the dura mater, nerve supply to the dura mater, we divide it into two parts. Nerve supply of supratentorial dura mater or nerve supply of anterior and middle cranial fossa dura mater, and the nerve supply to the infratentorial dura mater. Infratentorial dura mater is related with posterior cranial fossa. Supratentorial dura mater is related with anterior and middle cranial fossa. Is that right? Are you with me? Okay. Now, this is here it is anterior cranial fossa, here it is middle cranial fossa and posterior cranial fossa from the side. And if you see from the front, now we have to see the nerve supply. Yes. Which are the nerves which supply this dura mater in this area? Nerve? There is no anterior cerebral nerve. Nerve has to supply the pain. Okay, before you tell me very new things, I must say. First of all, here is a ganglion. What is this ganglion, please? Yeah, trigeminal ganglion. Excellent. This trigeminal ganglion, from here, three divisions come of the trigeminal nerve. One is ophthalmic, other is maxillary, and third is mandibular. Mandibular division. Did you know that? Right? If we put the ganglion here, then this is ophthalmic division, this is maxillary division, and here is mandibular division. Is that right? Actually, ophthalmic divisions gives the branches to the dura mater, anterior cranial fossa, and maxillary division gives branches to the dura mater in the middle cranial fossa, right? So ophthalmic division is giving branching and maxillary division is giving branches. Now again you may be thinking, why I am stressing so much? There is a reason. That if there is some tumor or some injury or pathological lesion in the supratentorial area involving the supratentorial meninges or disturbing the supratentorial dura mater, the pain will be referred in ophthalmic region. You know, ophthalmic division supplies supratrochlear, supraorbital. So patient will develop severe pain in the forehead. Or pain is in, if pain processes involving the maxillary nerve branches, pain will be referred in maxillary area. Am I clear? So supratentorial dura mater is supplied by the branches from ophthalmic division and maxillary division of trigeminal system, right? So when there are lesions the supratentorial region of the cranial cavity, and when they involve the dura mater of anterior cranial fossa and dura mater or dura mater of middle cranial fossa, patient will have referred pain in the forehead or in maxillary region. Am I clear? Opposite to that, infratentorial region or dura mater of posterior cranial fossa, that is having a branch from the vagus, 10th nerve, or it has meningeal branch from C1, C2, C3. You know C1, C2, C3? I'm talking about cervical nerves. Cervical nerve 1, 2 and 3 give meningeal branches which innervate the dura mater of posterior cranial fossa along with the meningeal branches of vagus. Now what is the importance of this? There must be something important. Important is that if there are pathological lesions like tumors present in posterior cranial fossa, they will give referred pain on the back of the head and in the neck. Am I clear? So if someone has a tumor in anterior cranial fossa, referred pain will be on the forehead. But if someone has a tumor in the posterior cranial fossa and of course tumor is stretching and pushing, disturbing the dura mater of posterior cranial fossa, referred pain will go to the neck. Am I clear? No problem with this? Then we come to these folds we have discussed, and now we come to certain spaces, right, of the CSF filled cavities. Just a very little revision. When we talked about the certain spaces, epidural space was between the, there are two types of epidural spaces, the cranial epidural space and there is vertebral epidural space. In the cranial cavity we have discussed epidural space. Epidural space is not actual space, this is potential space between the periosteal and meningeal layer of the dura mater. But when you come to the vertebral column, their epidural space is the real space. What does it mean? Let me draw a vertebra. This is vertebra. This is vertebral body, this is the canal, and what is it here? Spinal cord. Right? Now what I am trying to tell you, that pia mater is just with it. Then there is arachnoid mater here. Is that right? And I have to expand this area. This is arachnoid mater here. After that there should be dura layer. This is dura, and outside it there is periosteum of vertebral lining, and here it is now. What I really want you to appreciate is that there is a real space here between the periosteum of the vertebra and between the meningeal dura mater. There is actual space in vertebral column, but such actual space is not present in cranial cavity. And normally this actual space has loose areolar connective tissue with some lymphatics and some venous plexus. Right? No CSF. CSF should be in subarachnoid space. Here, CSF should be here. I'm talking about this area. Again, let me draw it more clearly. Suppose this is the spinal cord. Right? Now you tell me the layers. I will make them. What is this layer? Which is immediate pia, and outside the pia, what is this? Arachnoid. CSF is present in this space. We are not talking about subarachnoid space. Outside is there is dura. Is that right? And here is the periosteum. right, of the vertebra. This is the real space, full of loose areolar tissue, full of lymphatics, and full of venous plexus. But such space, when you go to the cranial cavity, there is only potential space. Am I clear? No problem? Right. After this, we come to some CSF filled enlarged areas. They are called subarachnoid cisterns. Let me tell you what are subarachnoid cisterns. Now, pyometer is throughout coming like this with it, right? And what is the outer area? Arachnoid. And in between, what is filled here? CSF. Now, there are some areas in which CSF cavity become very large. For example, we can look here. The junction of the cerebellum with the medulla, right? Here pia is like this, and arachnoid is like that. Now this CSF filled cavity become really small or large? Large, because there's too much difference between the pia and arachnoid. This should be called cistern, CSF filled cistern, and this cistern is called cerebellomedullary cistern. What is cerebellomedullary cistern? A cistern between the cerebellum and the medulla. Is that right? If we make this area more prominent, midbrain, pons, medulla, and here it is, and I will show you here. Yeah, there is spinal canal within it, which is CSF filled. Spinal canal within the spinal cord. As its spinal canal goes upward, right, it enlarges like this and makes a ventricle which is called, which ventricle? Fourth ventricle. Do you know that? Or you have no idea? Okay, you just trust me. That within the spinal cord there is a longitudinal canal full of CSF, right? We will have a full lecture on that. How CSF is produced, what are the ventricles, what are the different foramina, how the CSF circulates. But right now you just trust me. That within the spinal cord there is a canal which is called CSF filled spinal canal. As you move in the spinal canal, as it approaches to upper medulla, it opens up. Is that right? It dilates. So this is called fourth ventricle, right? Now, here it is, pyometer. What is it? Pyometer. And here there is a hole, right, through which CSF is coming out on the back, right? On the back of the fourth ventricle, posterior aspect of the fourth ventricle, there is a foramen which is opening in the subarachnoid space. Is that right? This foramen is called foramen Meninges. This is called foramen Meninges. Is that right? And through the foramen Meninges, CSF from fourth ventricle is coming into which cistern? Cerebellomedullary cistern. Is that right? And let's suppose here I make the, if this is the pyometer, this must be arachnoid. Now you see. Here arachnoid and pia are near to each other. Here they are near to each other. But here there is a very big gap in which foramen Meninges is throwing its CSF. So whole this area is called cerebellomedullary cistern. Am I clear now? Then, If you look from the back, now I'm making posterior aspect of the brainstem. You look from the back, this is midbrain, here is pons, here is medulla, this is spinal cord. And if you look from the back, this is spinal canal and this is fourth ventricle. It has two lateral openings. It has two lateral openings and then it becomes narrow as cerebral aqueduct. The fourth ventricle from the back. And what is here? What is this structure? Cerebellum. These are foramen lashka. What are these? Foramen lashka. And where was meninges? Meninges was something like this on the back. You get it? If I'm standing in the fourth ventricle, listen, I'm standing in the fourth ventricle. Here is pons, here is medulla. On the back there is cerebellum. And I put my hands into foramen lashka. And I can now put my hand into foramen meninges. Foramen meninges is opening into cerebello-medullary cistern. And when I'm putting my hands on the side, CSF from the foramen lashka is going out on the lateral side in a cistern which is present between the cerebellum and pons, right? It means that if you draw midbrain, pons, medulla like this, and here is cerebellum. Between the cerebellum and pons, this is pons and this is cerebellum, there is area full of CSF and foramen lashka is opening into this area, right? If we come to this diagram from the back, CFS is coming into this area. And what is this area? Cerebello-pontine cistern. Now let me explain cerebello-pontine cistern in another way. Attention, this is the brainstem. Attention please, this is the brainstem. Here is cerebellum on the back. This is cerebellum. If this is cerebellum, this must be pons and this must be medulla. Am I clear? Now if this is cerebellum and from here foramen meninges is leaking into cerebello-medullary cistern, and on the side it is leaking into lashka or leaking into cerebello-pontine cistern. Is it difficult? Clearly understood? Now, then there is another cistern which is very important. If you look at the midbrain from the front, I will draw the diagram now like this. From the front you look at the midbrain. This is front of the pons, this is the front of the medulla. Of course, pyramid, olive, pons front. And what are these structure? If you have studied this midbrain, this interior part of the midbrain, what is this called? Yeah, these two pillars of the midbrain which you see from here, these are cerebral peduncles. Have you heard of this thing? Cerebral peduncles. What are cerebral peduncles? These are the interior part of the midbrain. This is pons. This is medulla, pons, midbrain. This interior part of the midbrain are called cerebral peduncles. Now, this is right cerebral peduncle and this is left cerebral peduncle. Are you clear? We are seeing from the front. Am I right? Now, in between them, there is a gap here. There is a gap here. Here, there is a big gap between pia mater and the arachnoid. Pia is attached with the peduncles and arachnoid is more interior. So this is creation of another cistern. And what is this cistern called? Ventricles are inside the brain. This is outside the brain. This is called interpeduncular cistern. What is this called? Interpeduncular cistern. Is that right? Now we'll make a diagram and take the test of these cisterns which we studied. I want to see what you really learn or you just agree with me without learning. I will make small diagrams. You have to tell me midbrain, pons, medulla, spinal cord. What is this cistern? Just please. Yeah? Cerebello-medullary cistern. On this side there is a cistern. What is this? Cerebello-pontine cistern. And at this side there is cistern. What is this? Interpeduncular cistern. And on the back of the midbrain there is a cistern called here superior cistern. What is this? Superior cistern. And this is interpeduncular cistern. And they are connected with a special type of CSF filled area, and this is called ambient cistern. Ambient cistern. Again with the diagram. Listen. Let's suppose this is my midbrain. Here it is pons, and here it is medulla. On the back there is cerebellum. Now listen. In the front, midbrain is separated like this. Right cerebral peduncle and left cerebral peduncle. There's a gap little bit. The CSF in this gap is in which cistern? Interpeduncular cistern. Then on the back of the midbrain, there is some CSF filled area here. What is this? Superior cistern. And they're connected with ambient cistern. Here is cerebellum. Between the cerebellum and medulla is cerebello-medullary cistern. And between the cerebellum and on the pons, what is this? Cerebello-pontine cistern. Foramen meningeus opens into cerebello-medullary cistern. And foramen lesca open into cerebello-pontine cistern. Right? Then I think this is enough for today.